my name is Connor Howes and today I'll be completing ACVN Practical Assessment 40, Setting Up Theatre, and today is attempt number 1 and we'll be setting up for Jexie Peters, who is a 4-year-old bull arrow for a bilateral orchirectomy procedure or a cup stroke procedure. So before I begin, I've washed my hands with hot soapy water for at least 20 seconds and I've applied minimum PPE of disposable gloves and a mask. I understand that I should be wearing a hairnet at this time, however our clinic has run out and are waiting for some water to arrive in our order. Let's begin by damp dusting the surgical suite. This is to remove the thin layer of dust which accumulates overnight. So here we use V-wipes as our damp dusting protocol. You can also use a microfiber cloth which is damp as well, however my clinic like to use V-wipes. So let's begin. So I'm wiping down the door and the door handle. I'm coming to the light switches and the aircon switches. I'm now moving over to the trolley here. So this is going to be the surgeon's trolley. We want to make sure that we're getting the top, the sides, every part of the trolley has been wiped down. For the purpose of this video, I'm just going to go a bit quicker than what I would normally do. I now come over to the oxygen canisters. They always get missed and they're always covered in dust, so it is important that they are wiped down as well. We then want to come over to the anaesthetic machine. We don't want to miss any part of that. So we want to do the vaporizer, the soda line machine, the oxygen flow meter, the anaesthetic stand, the pole, the feet, the legs, and the wheels. Now we want to be coming over and we want to be doing the surgical like next. We don't want to be doing the examination table. We want that to be last in our damp dusting or cleaning procedure. And now the surgery table. So we want to make sure that we're doing the top, the entire top, all of the sides, and then we want to be coming over to the legs, the stand, the wheels, and the base. Okay, now that we have damped up to the surgery theatre suite, I'll now prepare and gather all of the consumables that will be required for Jexie's procedure. Give me one moment. So I have now gathered all the appropriate equipment required for this video. So we first want to begin by preparing our surgery table here by laying a fresh, clean towel over the top to ensure the patient is not coming into contact with the cold surface of the table. Then at this time, I will be setting up our active warming devices. Our clinic does not have bear huggers, electrical heat mats, or any other active warming measure for that matter. So unfortunately, I can't set them up. However, at this time, I would be doing it now and I would be switching it on, getting it warmed and prepared for surgery. Our clinic only has passive warming devices. So instead, I have prepared 2 hotties, which have already been wrapped up, ready to go in a clean towel, and that one there. So they'll get placed next to the patient as soon as he's induced onto the table. Then I have 2 blankets here, which we placed over the top of the patient when he is induced in surgery, and we'll tuck in all the extremities. Now we want to set up the trolleys. Our surgery suite does not have any other tables, benches, shelving, or any other areas for you to place consumable items. We only have our nurse's trolley here and our surgeon's trolley here. So they always get left to the side of the surgery suite or in the corner while we are setting up, while we're preparing ourselves, while we're preparing the patient for surgery as well and doing the surgical skin PRAC. And then once the surgeon is scrubbed in, is ready to be gowned, and is ready to begin surgery, that is when we will reposition the surgical trolley for him. So it's accessible, but it is out of the way as well. So let's position the surgical trolley here for the nurse. Now we'll reposition the surgeon's trolley here. I prepared some sterile gloves and masks for the surgeon. Plus I have some 2O monofilament suture here, and then I also have a 3O PDO, a 3O skin suture here. So these are all sterile, so we want to be checking for sterility and package integrity as well as the suture material. We want to make sure that it has not been opened, it is not coming from apart from the seams, everything still seems to be intact. Doesn't look like there's been no air exposure in there. And I am happy with that. It's not wet, it's not damp in any way. And then we'll go with the skin suture. So now we want to check the kit for sterility as well. So we want to be making sure that we're not overhandling it. We want to be checking that there's no wetness, no dampness, there's no condensation, there's no water droplets. We want to be looking at the indicator strip immediately, making sure that it has reached the pass line, and the autoclavable tape has changed colour from green to black. We then want to be now checking the package itself. Are there any holes that can be seen that is coming out of, that air would have been exposed into it? Does it look like all the tape is still intact and hasn't come away from the plastic sleeve, which I'm very happy with that. And all the tape still seems to be intact, there's no holes and everything looks really good. So now we'll do the fenestration drape. Okay, already I can see that whoever has packaged and autoclaved this hasn't folded along the dotted line and hasn't stuck it down correctly. So as you can see, there is already a hole that is coming out. So this would be considered not sterile. It would have to be reprocessed, re-autoclaved until we can use it again. So I'll just go grab another one and then we will check that for package integrity as well. So now I've got another fenestration drape here, and now I'll be checking for sterility. So there's no water droplets or condensation. The seal is still intact and it does not come away. So I'm very happy with that. So we can use that as our sterile fenestration drape for today's procedure. As we're finally setting up, we'll also set up the kick bucket. So you want to make sure that it is freshly lined with a new bin bag and that it is placed out of the way of the surgeon, but it is still accessible. So we place it under the surgical table. Now finally, we want to make sure that we set up the anaesthetic machine in the correct place as well. We just want to position it right next to the surgical table, clamp it down if possible, and we also want to make sure that the surgical table has been positioned and everything is in the correct spot for the surgeon ready for surgery. Well, other than that, that is everything for today. That is Practical Assessment 40, Setting Up Theatre.